So, hey everyone, thank you for everyone that could join for the last seminar of YMS for the year. So with that, let's get right into it. So to give an introduction to Dr. Kimura, he's an emergency doctor involved in the field of trauma, and currently he works in the practice of emergency medicine at Kaiser Oakland Richmond Emergency Department. So with that in mind, let's get right into today's seminar. So if you could, Dr. Kimura, to get us started, can you tell us a little bit about your background and career in medicine and where you grew up?
Yeah. Hi everyone. Thank you for joining us, and thanks Akash for setting this up. I grew up outside of Washington D.C. My parents immigrated here in the '70s for my dad's job from Japan. I'm an only child, so I grew up speaking Japanese at home, and any good second generation child of immigrants, I was instructed that my career choices were medicine, law, or engineering. Um, sort of half joking, but they really encouraged that. And fortunately, I was fairly interested in science and in medicine also, although I don't think I really knew what it was in college. Um, I went to college at George Washington in Washington, D.C. And during that time, I sort of explored um, medicine by volunteering, either at the hospital in DC or also homeless clinics, kind of stuff like that. Part of it was resume building, but also exploring my interests. And I remained pre-med during that time. And but I think I wasn't really sure why I wanted it, which might explain why I didn't get into med school when I applied in undergrad. Um, so I took a gap year. I became an EMT. Only worked for a little bit, and then went to grad school where I met your dad, Akash. Did a couple years there, sort of I think that was like a backup career plan. My undergrad degree was in chemistry, and it's hard to get a good job in just straight chemistry. So I did a couple years in chemical engineering and sort of brushed up my resume and reapplied and got in the second time. So it worked out. I think they like to see persistence and also I think I was older and more sure of myself and sort of more aware of why I wanted to get into medicine. Like the fact that I'm good with people, and I also enjoy applying scientific knowledge to helping people. So I think my second application was stronger for that reason. So then I went to UCLA, and from the beginning was kind of interested in emergency medicine. I think a lot of it is a personality fit. Um, I think one of the first questions, I'm going to just start answering some of those. Some really good questions that you gathered. Is that why I chose to do emergency medicine? I think it is a personality fit. Emergency medicine attracts people who are adventure seeking, also short attention span. That's me. And so working in undergrad, I mean in med school, there's so much school. During med school, like working in the ER, like you do a rotation in the ER, and then I just found that I sort of got along with these people the best, other than more so than surgery or internal medicine or the myriad of other things that you rotate through. So um, that's part of why I ended up, and I'm very happy with my job right now. So hopefully that gets you caught up to how I got to where I am.
Okay, thank you for that little background on how you got into medicine. So, without stopping, I guess we can start going into the Q&A for our officers. And unfortunately, as I mentioned earlier, due to AP and tests and sports, a couple of them couldn't show up. So instead, we will start with Akarsh for the first question.
Hi, Dr. Kimura. Thank you for coming.
Sure.
My question is, are there any experiences going through med school or going through training that stand out to you as key learning moments?
Oh yeah. There's certainly anecdotes that I remember. Uh, while volunteering in the ER and seeing a sick patient being cared for the first time, and uh, how medical interventions can really turn somebody around. But also, there's a limit to what medicine can accomplish, and so first time becoming aware of that kind of thing was eye-opening, I think. Um, yeah, you know, it's the plus side of medicine as a career. Every day is different, especially in internal medicine. I mean, in emergency medicine, every day is different. Every person is different. The cases are always interesting, and you see people from all walks of life, some at their best and some at their worst, and it's a lot of practicing compassion for people who are, not having a great day in general. That's, people are having a happy day, don't come to the ER. So there are a lot of experiences I can't really, partly because of patient confidentiality, I can't really go into the details, but um, that's part of why I like my job. That and the teamwork, uh, nurses, other doctors, techs, family members, they all become one team in trying to get a person from their sickest to back on their feet, and working together like that. And when it works like an well-oiled machine, when it most of the time it does, it's really satisfying. Um, I did write down some notes, I think, based on your typed out question, Akash, about so a couple of the challenges I think in emergency medicine. It is the it is the front door of the hospital. So we get all of the, everybody comes to us. We're sort of like the catch-all. Um, and so I see a lot of people who are affected by societal problems that I are, like, frankly, are way too bigger than anybody can tackle. Homelessness, inequality, health disparity, the messed up health insurance system in this country. Um, so that can sometimes be frustrating, just because it feels overwhelming and like you don't know what difference you're making. But um, like that story with the guy on the beach throwing starfish back into the sea, you do one at a time and make a difference where you can. The other challenges that I thought of are, you have to be okay with smells, bad smells, and guts and blood. Um, and the essence of emergency medicine is multitasking. So there's always interruptions. You're juggling multiple cases, and at first you're not good at that. It becomes overwhelming, and it definitely, like, my family pays the price for it, because after I get home from a shift, I can't even make a decision on like what I want to eat for dinner. I just need to, to relax. So that is one challenge. I sort of thrive on it at work, but it definitely takes a toll. Uh, and then more so than a lot of specialties in medicine, emergency medicine will always involve nights, weekends, and holidays. So that's a trade-off. Because I have two fairly young kids, they're 7 and 9 at home, and for childcare reasons, I do 100% nights. And it just works out better because my wife works mostly days. So it does lead to a lot of grumpy parenting, but the kids seem to deal with it okay. So, and then lastly, I wanted to not forget emergency medicine. So in medicine, there's definitely an unspoken hierarchy uh, where, for example, neurosurgery surgeons think they're the bomb, and pediatricians are sort of at the bottom. But doesn't have to be like that everywhere. Emergency medicine, the challenge is that as a specialty, we're sort of there to patch up the emergent problems and then bring in the specialist when we need them. And so we're calling specialists constantly. And so that relationship, you have to be sort of good at navigating. But the beauty, one of the beauties of working at Kaiser specifically is that it's a physician group. So everybody in the group is in it together, sort of. So there's a lot less of that personality conflict. When I was at my residency in the Bronx at Jacobi, there was a lot of conflict between like emergency medicine wanted something done and the consultant said no. And we're sort of, it's like a power struggle. And what should really happen is we should be looking for what's good for the patient. And I think that sometimes gets lost. So, but I'm happy where I'm working. Kaiser's a really good job, and like, for the reason I said, we're collegial, and I think we really do try to make the right decision for the patient. So, anyway, I'm going to ramble on these questions. We can go to number 2, I guess.
Yeah. Hi, Dr. Takamura. My name's Adrian. I'm the secretary of the club. And I was just wondering, how has COVID impacted your work and the patients you deal with?
That's right. Man, what a year it's been. I actually I was one of the providers to take care of one of the first patients off the cruise ship that came to Oakland port. I think that was in March last year, and they came to Kaiser looking really sick. And I think there was a lot of fear at the time amongst the providers. And then over weeks and months, we sort of learned to manage it. One benefit was that so everybody got scared of coming to the hospital. So the emergency department really got actually kind of empty. But the people who were coming all had COVID. So we got really good at treating it because we were seeing it over and over and over in all different stages. I guess as a department, we saw a lot, but we did the initial work. Like I said, that's what emergency medicine does. The most of the emotional burden and the sick ongoing care fell on the ICU, and I feel really sympathetic to them because they really had a hard time. And then the other face of it is the patient experience. Really was difficult, I think, because one, we weren't allowing any visitors or family. These people are coming in and they're told to wear a mask and they can't breathe. And then they sit in a bed and they're surrounded by people who are all masked and goggled and like they look like, coming in from a spaceship, and like it's very impersonal. The whole reason people come to the hospital is to feel better, to feel cared for. And it's hard to convey that you care through, if your face is half covered. You can't, they can't see your facial expression. They don't even know one doctor from another because all they see is your eyes behind goggles. So I think the patients had a really hard time, and then families also, they were forced to stay outside and like they didn't know what's going on. And so I think that it was really hard on them too, and continues to be. We're now finally, hopefully, I think, seeing some light at the end of the tunnel, and now we're allowing some visitors in and stuff, and that has made a big difference. At the same time, we're now seeing regular patients coming back, and now we're getting busier. But I think that's a hopeful sign. The other thing I wanted to mention, there's a lot of talk of calling us like in heroes in as frontline workers, which I guess we get a lot of praise and appreciation, which feels nice, but it's also can be a burden on physician mental health, because at one point we didn't have enough masks, we didn't have enough face shields, but they were, you're a hero, you have to step up, don't complain, you need to do what you need to do. forget your own safety kind of thing. It never quite got to the point where I felt unsafe, but I know in other cities that were more hardly hit, like New York, and at points other cities where it was nurses were having a hard time. So that was another COVID impact. But again, hopefully things are opening up and numbers are down, and it seems like vaccine works. In California, vaccination rates are really good. So I think we will keep getting better.
All right, thank you.
Sure.
I had another question.
Yeah.
And what are some critical milestones in your career? And are there still some things you still want to achieve?
Oh, okay. Yeah. I saw that one. I think so. Your biggest growth years as a physician are the year after you graduate med school. The first year called your intern year. That's when you start actually doing the actual work of taking care of patients, like carrying a full load. So learning how the hospital works, learning how to do all that work is huge. And then, but still, then you're supervised. There's somebody that you can ask questions of. So that is a supported year. And then your first year out of residency is also a huge learning year. First year as an attending, because you're really like the buck stops with you. So I think those were the biggest milestones. And I don't know, I'm pretty mid-career, I guess, because like I said, I didn't get into med school the first time, so I'm a little bit older than my colleagues of the same graduating year. Excuse me. And I don't know if medicine's always evolving, so keeping up with the literature, keeping up to date with the latest information. COVID, we learned so much over the past year, so that's an ongoing effort. But I don't call it an effort. I kind of enjoy it, obviously. And then you get to keep learning, and also we have emergency medicine residency from a nearby hospital that rotate with us. So in the emergency department, so teaching them keeps us on our toes, and so that's really good. Looking more broadly, I think you gotta in life, you gotta play to your strengths. I think mine are sort of people skills, at least in small groups, one-on-one. So I think I fell into a job that I can really make use of that. But always be exploring your weaknesses, sort of be pushing against your areas of discomfort. For example, public speaking, leadership, those things were, as an introvert, very uncomfortable for me at first. But practice and mental work, grounding yourself, checklists, and then as you do it over and over, you just kind of find your way to be comfortable in an uncomfortable situation. I think that applies to any challenge in life. So I try to always be learning from my colleagues, always be learning from my mistakes and my challenges, and try and push against them. So that may be sort of a vague answer to what you're asking, but it's sort of what I hope for myself. So you want to go to
Yeah,
number
so
four?
I have
Yeah, or sorry, go ahead.
oh sorry. I actually had one last question,
Of course.
and it was like, what's like the most challenging procedure you had to like execute, and like how to go down, and like what are like what are
Yeah.
like some things that keep you motivated during those times?
Yeah, right. Surprisingly, there's very few things, even in trauma or emergency medicine, that are seconds that you have to intervene. The main thing that I think of is airway. So if somebody cannot if something is obstructing their airway, gunshot wound through the neck, and they can't breathe, that is, you got to fix that right away, or the patient will die. So that situation can be stressful, but I think years of training, just mental preparation and going through it over and over, and then knowing what to do and knowing who to call on for help, that really gives you some help. And having gone through it and knowing that you can, having the confidence that you can, that also helps you get through it. And in stressful situations, everybody's mind goes blank. You just fall back on your training and again, getting comfortable with that uncomfortable situation. So whether that's training in sim sessions, which we sometimes do, probably not enough of, or just going through the situation over and over. That's the way to do it. Things that are less procedural and challenging that I came up with, dealing with an angry patient or angry family, unreasonable expectations. People are scared in the emergency department, understandably. They're sick and they're worried about their family member. And a lot of times that comes out as anger. Some people feel like you're withholding care, or which is never the case. But so finding common ground, interpersonal stuff, I find is really challenging. And then you mentioned how the field might change in the future. Technology-wise, I think ultrasound is the biggest thing. That's machines are every year getting smaller and more easy to bring to the bedside. So and it's non-ionizing radiation, so you can do as much as you want. Applying that to sick patients is like really life-changing, because it really lets you make decisions on a second basis, on a minute to minute basis. So hope that answered your question.
Okay, so I have a couple questions for you now too.
Yeah.
So the first one is, has your career been exactly as you expected? And have you faced any surprises that may have changed your perception of the field?
Yeah. Let's see. I mentioned earlier I didn't get into med school the first time. I took a few years off. Once I got in, I didn't really know what I wanted, so I explored OB, surgery. I think came back eventually back to emergency medicine, because I think it just fits best. I worked in a couple hospitals before I ended up at Kaiser. All different settings. One was in the Delta in Antioch. One was in the Bronx. Every hospital is different. They all run a little bit differently. The medicine is the same, obviously. I also worked in Hawaii for a couple months, which is amazing, as you might imagine. Yeah, I don't know. It's an exploration. It's a long road. So I think be sure before you go into it that it's what you want to do. I think the way to be sure is to do what you're doing right now: interview people, shadow them if you can, volunteer, all that. More exposure, the better, and then the pros and the cons, and whether you really want to commit your life to it. There's other ways to get into medicine. You can be an RN or an NP or PA, which is a lot shorter route, a little less responsibility, but some people crave that, because you're always sort of supervised. So I guess one surprise that I realized a while ago, so it's not new to me, but that it's a lot more about customer service than I thought. I worked a little bit as a waiter in undergrad, nothing fancy, but I use those skills a lot more on a day-to-day basis than you might imagine. You know, making people comfortable in the ER really makes a difference in their perception of you. You know, they might not remember what you say, what you did, what their diagnosis was, but they will remember for sure how you made them feel. So um, that's kind of a surprising thing. You think it's all science and medicine is ivory tower, but it's not. It's really, uh, at least especially in emergency medicine, it's a lot of interpersonal stuff. So
Okay. Thank you for that answer. And then, one of my other ones was, how are you effectively able to make decisions in a high stress environment in the field of trauma? And like, what is the hardest choice you think you've had to make during your time in the field this far?
yeah. Like I was saying earlier with the seconds to minutes decisions, I think you fall back on your training, and algorithms help. So we have everybody learns the first thing in trauma is ABC, which is airway, breathing, circulation. Um, so if you get lost, you just go back to, okay, reassess the airway. Airways, okay, guy's talking or breathing, whatever. He's breathing. Is he bleeding, or how is his circulation? Like, does he need blood, or do we need to stop somewhere that's bleeding out? Put a tourniquet on, whatever. Um, so that's how you rescue yourself. And there's specific algorithms for trauma. They're intentionally not complicated. It's not rocket science. It's really just a crutch to get you back on your feet when you get lost, which everybody will. Uh, there's a target range of stress where you don't want to be too relaxed, because then you're going to be too laissez-faire, and you don't want to be too stressed, or else your mind is going to go blank. So there are ways to sort of find your feet, go back to reset your brain if you get too excited. And like I said, there's one or two things that you really need to address right up front, and then you have minutes to think about the next steps. And then I really rely on my colleagues, so my nurses, I I think this is a airline industry something that I'm probably misquoting it, but how the airline companies that had the most hierarchy between the pilot and the co-pilot tended to have more accidents. So co-pilots who felt comfortable correcting the pilot, who felt comfortable with that relationship, created a safer environment. So same thing in medicine. Like, if I poll the room sometimes and say, anybody else have any ideas? Like, a lot of the times the nurses see something that I don't see. So that makes a big difference. I've been reading a lot about this stress inoculation. I don't know if you heard of Wim Hof, some of these mind over body kind of people. Definitely, so controlling your breathing, putting yourself in stressful situations, and then teaching your brain that you can deal with it. And your brain is like, oh, I've been here before. I don't need to freak out. That kind of thing really helps. So sort of I've been working on that. But you're right. It's kind of scary sometimes. You asked about hardest decisions. I don't know. I don't know if I think the hardest decision is sometimes when to stop, when to not do something, when you want to just stand there and see what happens, or when you want to decide that anything else is futile and cruel. Especially young patients who are dying for whatever reason. You want to do something. You want to make you want to stop it, and sometimes you can't. Um, so making that call is sometimes the hardest thing.
Okay. Thank you. And one last question I have before opening up to the member Q&A. Um, which you kind of answered already, but are there any suggestions or piece of advice or like maybe even any specific remarks you might be able to offer to those interested in going into trauma in particular?
Oh, yeah. Sorry, you keep saying trauma and it's technically not, because no, it's okay. It's okay. Emergency medicine, there's a lot of overlap. And trauma technically would have to be at a trauma center, and we are trained in trauma, but Kaiser, Oakland, Richmond are not trauma centers, so we're not brought trauma to the same volume as other hospitals might be. Richmond is in a pretty bad neighborhood, violence-wise. So there's certainly patients who their friend brings them in because they got shot, whatever. And so we do deal with trauma, but not on a day-to-day basis. And I wouldn't call myself a trauma specialist, no. Although in residency, we're all trained for it. So I'm sorry, I lost track of your question.
Yeah, so I'll just repeat it for you.
Yeah,
So
thank you.
are there any specific remarks you might be able to offer to those interested in going into emergency medicine?
Yeah. I appreciate that. I think like I said earlier, explore it and sort of get to know it. That's the best way to see if it's a good fit. For example, my wife is also in medicine. She's an internist. She does not like the emergency department at all. It's too chaotic. It's too much uncertainty. You have to be okay with making decisions on limited data, a lot of uncertainty, and then you have to be sort of okay with being wrong some of the time because you don't know all the data. She would much rather gather as much data about what situation as possible and then sort of go from there. And then she enjoys managing patients on a more longitudinal basis, like multiple days in a row. She takes care of inpatients, but she doesn't do a clinic. But same idea in the clinic. You're seeing patients over months and years and get them build a relationship, which I don't do. Like I see you once, maybe twice, and you see somebody else the next time you come. So pros and cons for both. But so again, personality fit. If you sort of get along with the kind of people who are in the field, then that says a lot, I think. And if you feel comfortable around them, enjoy their company, then you're going to fit in with the job also, I think. So.
Okay. Thank you for answering that question. So if any people or any of our members right now have a question, go ahead and raise your hand. This is the time to ask him a question. And let's get right into it. Below? Below?
What is the main difference between emergency medicine and trauma?
Trauma, I would say trauma is just trauma, as in it's a category of injury. There's trauma surgery, which is you specialize in taking trauma injuries to the OR to fix them. Emergency medicine encompasses the initial portion of taking care of trauma patients, stabilizing them enough so that the trauma surgeon can do their work. But it's a small part of what we do. So I don't know if that makes sense, but there's no specialty within medicine called just trauma. So trauma is one of the illnesses that we see, I guess, is a better way to put it. Does it make sense?
Yeah. All right. Thank you.
Okay. Yeah.
Okay, and the last one will be Yubin.
Yeah, my question is, how hard exactly like is it to get into med school? Because I hear about how hard it is a lot, and I'm just curious.
That's a good question. Numbers wise, I don't know what the rates are. I know I had a hard time the first time, so I got to the point of a couple interviews and then didn't get in. Um, you know, much better luck the second time. And my, my grades, my scores were not that different. I think it was, I was demonstrating that I was committed to it, I think, by applying twice and stacking up volunteer work. And I think demonstrating that you know what you're getting into and that you're going to work hard and that you're convinced this is what you want. I think that's goes a long way. Grades and scores, obviously, you need them, sadly, but it's a lot rests on your drive, I guess, and demonstrating that to the application people. And then a lot of it is just crapshoot, Yeah, they get so many applications and they can't accept everyone. So there's a whole philosophy on whether you should have a plan B even. Some people say it's better not to, just because that makes you all the more driven. But like I mentioned earlier, if you just want to get into medicine, but maybe don't want all the responsibility of being, the first person named in the lawsuit, then you could be an RN or you could be a NP or PA. NPs and PAs do a lot of the same work as physicians do. So something to think about anyway.
Okay. Thank you for answering those questions. So
Yeah.
to conclude, I just wanted to let everyone know thank you for those of you who were able to show up to today's seminar. I know it was a bit harder because of everything going on with the school year ending, but thank you for everyone that was able to make it. Thank you, Dr. Kimura, for being able to take some time out of your day to talk to us about what being an emergency doctor entails. And see you all next year at the next YMS seminar. And have a good rest of your day.
Good luck on all your AP tests or whatever else you got the rest of this year. Have a nice summer. Of course, you're going to be a senior next year.
Yeah.
Yeah. Well, good luck with everything. Good luck with your applications to wherever you go. I just wanted to mention emergency medicine has taught me, life can change in a moment. These people are walking down the street and they get in a car accident or, diagnosed with cancer. It really can rock your world and you never know. So treasure every day, even if you're going through the pain of studying for AP tests. Try and enjoy it. And then lastly, like I was mentioning with these family members that are upset with you or, life circumstances that are upset with you, don't take things personally as much as you can. Everybody's going through their struggle. So compassion is the way to go. But good luck, everyone. Thank you for having me.
Thank you.
Yeah.
I appreciate it.